When, during a course of treatment, is gilteritinib used to treat FLT3-positive AML?
Gilteritinib is now being used only in the setting of relapsed and refractory acute myeloid leukemia. That's where it's approved. Relapsed and refractory means that you had leukemia, you got treatment, and the treatment didn't work. Or you had leukemia, you got treatment, the leukemia went into remission, but then it came back down the road. So that's where gilteritinib is currently approved. There are some exciting clinical studies that are looking at the use of gilteritinib in combination with chemotherapy for newly diagnosed acute myeloid leukemia. Whenever you have a good drug that's being used in the relapse and refractory setting, we don't want to keep it there. We want to give our best drugs at the very beginning of treatment. So this clinical trial is looking to see, does gilteritinib in combination with chemotherapy work better than chemotherapy in combination with what's called a first generation or a less potent FLT3 inhibitor called midostaurin.
Who are the most appropriate patients to receive gilteritinib?
So gilteritinib is appropriate for anyone with a FLT3 mutation who has relapsed and refractory AML. That is what a patient in 2022 should get. That is what a patient should get. That is the standard of care. There are clinical trials that are investigating gilteritinib in combination with other agents for relapsed and refractory AML. I always encourage my patients to seek out a clinical trial because clinical trials work to try to do better than the current standard of care. But a clinical trial that you might be interested in for FLT3 mutant AML should be one that incorporates gilteritinib into that trial.
How is gilteritinib administered?
Gilteritinib is an oral agent that is given once daily, easy to take, just like taking a Tylenol. No big side effects.
What are the common side effects of gilteritinib, and how are these side effects typically managed?
Gilteritinib is approved in the United States for patients with relapsed or refractory FLT3 mutated acute myeloid leukemia based on the results of the AML trial. In general, I believe gilteritinib is well tolerated by patients with very little GI toxicity. The major toxicity I observe in my own patients is myelosuppression, which is manageable.
Thanks for watching. By creating a HealthTree account, you can get exclusive access to the latest HealthTree University content, track your course progress, take notes, and bookmark lessons. Visit the links in the description below to get started.